Well, good afternoon, everybody, and welcome to our session. Appreciate your being able to join us today. My name is Greg Smith. I'm Executive Director of the Florida Literacy Coalition, and we're pleased to be here to talk with you a little bit about health literacy and about adult education and literacy, and in some of the partnerships that we've been able to develop over time to our mutual benefit with community partners. Our organization, Florida Literacy Coalition, is a statewide nonprofit organization that serves as a professional development and resource center for adult educators here in Florida. We've hosted a health literacy initiative and grants program for the last 11 years, which is funded through the Florida Blue Foundation, which is our Blue Cross and Blue Shield here in Florida. And it really has a heavy emphasis on developing and sustaining community partners. And we want to share with you a little bit about what we're doing and what we've learned through that process. Next slide.
So I just want to add, Greg, hi everybody, I'm Heather Surrency, and I am the Health and Financial Literacy Coordinator at the Florida Literacy Coalition. And Greg and I are educators, and so we love feedback. We love to kind of hear what's going on and your thoughts as we go through this presentation today. So if you're up for it and have a QR code scanner, we do have a Jamboard set up with a few questions that you can put little sticky notes on and give us your feedback or your opinions on what we're talking about. Also here, you can just click on, or you can log on this website with that address down in the bottom right. So we'll give you just a second to either scan or put in that code. And then I think we might be able to put the code in the chat as well if you want to participate.
Okay, well, great, Heather. Thank you. So our objectives for today, and here's our session objectives. We'll be talking with you about health literacy, of course, but also about adult literacy and the challenges that we face as a country with a sizable population of teenagers and adults who simply lack basic functional literacy skills. We'll be talking about how adult education programs work with limited English proficient adults as well, comprised largely of recent immigrants who want to build a new life for themselves and their families here in the US, and recognize the tremendous benefits of being able to read, write, speak, and understand English. We'll discuss how adult education programs, along with health providers and colleges, public health agencies, and other stakeholders can work together to achieve what are often common goals. And we'll share with you some strategies and ways that we've partnered. And when it's done well, we find that it's a real win-win situation for the respective organizations, but most importantly for the patients and clients and students that we serve. Next slide. So who are the adult educators? Well, it really is a range of different kinds of organizations that work in this area. Typically, they tend to be school districts that may have technical college or other kinds of adult ed programs, community or state colleges, a whole host of nonprofit organizations that work in this space. Some of them may be specific and only focused on adult education and literacy, and others may have it as a smaller component of a wide range of other services that they offer. Libraries, in many states, libraries are some of the primary providers in adult education, and then corrections, our prisons and jails are also providers. We list here the directory, the National Literacy Directory, so you can use this as a resource to find out what kinds of organizations exist in your community that work in adult education and literacy. Who are our students? Well, here too, we have a spectrum that's quite broad, including individuals who were born and raised in the United States and never learned to read, people who want to get a high school diploma or GED. Many programs emphasize helping people develop workforce and career skills, integrated education and training programs in which people attend adult ed classes while also pursuing a career-related credential, such as studying to become a CNA or certified nurse's assistant. And of course, with the ESOL programs, serve lots of immigrants, some are not literate in their native language, and others have advanced degrees from their home countries, including nurses and doctors and other healthcare practitioners. Next slide. So literacy, what is literacy? Well, just to kind of give you a basic definition, literacy is the ability to use written and printed information to function in society, to achieve one's goals, and to develop one's knowledge and potential. So that's a fairly broad-based definition used by the National Assessment of Adult Literacy. I think it captures most of what we want to do. There's different kinds of literacy: prose literacy, where you search, comprehend, and use information. For continuous text, to document literacy, which you also very much do the same, but with documents and forms such as job applications, payroll forms, tables, drug and food labels, and so forth. And then quantitative literacy, which is more emphasized, which emphasizes math and the process for interpreting, solving, and applying equations in different types of real world situations. We add to that, especially in this last year and in recent years, digital literacy and problem-solving skills that have to do with being able to use technology and computers in particular. Next slide. So there's 43 million people, it's estimated, that have below basic literacy skills. A whole lot of folks. And I don't think this is as known as it probably should be. According to the most recent national research through the National Center for Education Statistics, about 1 in 5 adults have less than basic literacy skills. And nearly 1 in 3 have less than basic numeracy skills. So it's a big problem. And this was actually done as part of a study called PIAC, which was an international study that compared the US to other industrialized countries. And unfortunately, we didn't compare very favorably. We came in below average in both areas. So the costs are significant. The human and economic costs are incredible, and estimated between 106 and $238 billion in healthcare costs alone linked to low adult literacy. And even a modest improvement in literacy and education levels would have major economic impact in the trillions. On an individual level, there's a strong correlation between education and income, with research indicating that the reading level of parents, particularly mothers, is a very significant determinant of a child's future academic success. So this really speaks to the strong intergenerational driver when it comes to literacy and the need to break that cycle of illiteracy, which is why there are certain organizations that focus on family literacy, which is a model that works with parents and small children in a holistic type of way. Next slide. So this slide shares with you a little bit about health literacy. There was a study done called the National Assessment of Adult Literacy that took a look at health literacy and adult literacy, and there was a strong correlation between the two, as you might expect. And I wanted to share this information just to kind of give you some context for what we're talking about when we're talking about low health literacy scores. So about 14% of the American population were rated to be at below basic health literacy. These are folks that would have difficulty doing something as simple as circling the date on a medical appointment for an appointment slip. Those folks that fall into the next category, basic, 22%, would have difficulty given 2 reasons why a person should be tested for a specific disease after reading a pamphlet that clearly provides information on that. So this is really core, fundamental kinds of things that folks are challenged with. And again, a very significant number of people in our country. Only 12% of the population, according to the study, was at the highest level, the proficiency level. Next slide. And this gives you some data that kind of correlates with a a lot of the demographic indicators or factors that come into play when we're working with adult education and literacy students, and really showing that a disproportionately high number of folks that we serve in adult education, really do have below basic health literacy skills. So those who have not graduated from high school, those who speak English as a second language, older adults, folks, Hispanic adults. There's a number of folks, people who have disabilities that have disproportionately high percentages of the population that have below basic health literacy as compared to the general population. Next slide. And with that, I'll turn it over to you, Heather. Thank you.
Okay, thank you, Greg. So when we're talking about health literacy, I just wanted to point out a study that was done in 2008. Many of you may have seen this before, but there's some more kind of complex scales that we use to assess health literacy, especially in patients. But from talking with clinical providers, typically there's not much time to do that, especially in the hospital or ER setting. There's really just not time to do a true health literacy assessment. And so this can be a great way to kind of get to know your patient or person that you're trying to educate and figure out where are they in terms of literacy. So simple questions like, how often do you have someone help you read materials, medical materials, forms, informational materials? How confident are you filling out forms by yourself? And how often do you have problems learning about your medical condition because of a difficulty understanding written information? So I'm going to kind of share as we go along a lot of the stories and anecdotes that we've heard from the health literacy providers that we work with at Florida Literacy Coalition. And oftentimes we hear reports of adult learners not wanting to tell someone about their literacy or educational challenges. Maybe they have a learning disability. Maybe they had a negative educational experience and did not get their high school diploma. Perhaps, as Greg said, they speak English as a second language or were raised in another country and they don't feel comfortable. And so really asking open-ended questions, and we know about teach back, but also asking questions about literacy can really help to improve, I think, the conversation that we have during health literacy teaching opportunities. Another study I just wanted to show is, and this has been replicated, I know, in several different studies, but we have to realize that patients either in the hospital or even from just a doctor's office visit are not retaining the information that they're given. So how can we manage that? Even if they are kind of given good information, are they comprehending it? Do they have the numeracy skills to understand what is being said? So really there's a lot of different levels in terms of assessing a patient's health literacy. And the readability factor of the materials is just kind of one of those components or one of those pieces. So I know everyone's probably seen these red flags for low health literacy before, but the way we kind of look at these red flags in the adult literacy world is when we have patients who are missing appointments or when we see people not completing paperwork, we really want to dig down and figure out what are the reasons for that. Does it have to do with literacy? Does it have to do with someone's confidence and their communication skills, or as I said, their numeracy skills? So while it can be frustrating when we have patients that we kind of feel are being non-compliant or are not following guidelines or recommendations, if we dig a little deeper, we'll often find that there could potentially be reasons, including literacy and other factors that are affecting their ability to access and follow through with healthcare recommendations. So the benefits of effective communication, we definitely know these within our own experiences, probably in the healthcare system or in an education system. But we see patients having higher satisfaction about their care. We see an increased adherence to their treatments. They recover more quickly. They have less anxiety and stress. And really that's a lot of what we try to do in adult education in terms of health literacy is giving adult learners the skills and the confidence to be able to set up an appointment, to access healthcare, to access health insurance, for example, because really for many people, they feel insecure and they feel like it's stuff that they should be able to do and don't want to admit when they're struggling. So, you know, as we continue to look at social determinants of health, I just want you to kind of think about your community or your organization and consider whether low literacy in the adult population is really viewed as a public health problem. Because when we look at the social determinants of health, we know that education, access, and quality is definitely a public health issue. But many times I think we consider K-12 literacy as opposed to considering, as Greg illustrated, the millions of Americans who are not reading and do not have the math skills on the level that most of the healthcare information that we provide them, they're not at that level at that time. And we know that literacy and education affects economic stability, right? It affects our communities, it affects where we live, what types of jobs we have, our access to healthcare. So I think it's really useful for you to start to think, in my community, are we really looking at literacy in terms of being a health problem? So I want to tell you a little bit about the Florida Health Literacy Initiative. So while this might not be easily replicated in other places, we have had a great opportunity to work with a large number of adult education students. And we've learned a lot of lessons about health literacy through those interactions. And kind of one of our goals of today's session is for you to realize that as you increase your interaction as well with adult learners, you will learn a lot about health literacy, a lot about the obstacles that people are facing, and a lot of kind of approaches to dealing with some of these difficult issues. So we partnered with the Florida Blue Foundation, who has been most generous in funding a statewide health literacy program. They've contributed more than $1 million directly to working with adult literacy students. So through this initiative, we provide grants, training, and educational materials, as well as technical support to adult education providers. And we have awarded more than 60 mini grants. So while we're doing this on a state level, I would encourage each of you to think about, in your role, you know, do you have adult education organizations in your area? And that's one of my Jamboard questions, if you want to answer, you know, who is providing these services in your area and have you partnered with them? In Florida, you know, we have this kind of system set up where I develop curriculums and materials and provide training for adult literacy instructors and tutors in order for them to in turn teach their students. And that's where we have a great opportunity for partnership, because these teachers are not experts in health. They are not public health professionals. They are not clinical professionals, but yet they're trying to, in their own way, educate our communities about health literacy. So we've served more than 21,000 students during the last 11 years that we have been doing this health literacy initiative. And we'll tell you a little bit about kind of the pieces that we find are successful in terms of having a community-based health literacy program like this. So we really focus kind of on 3 areas. We focus on making sure that adult learners understand kind of clinical aspects of their healthcare. As I mentioned earlier, how to make an appointment, how to fill out forms. If they do have insurance, how do they kind of use their insurance? I was sharing with Greg earlier, I have an 18-year-old who didn't know what her insurance number was. No one told her when she was making an appointment that it was on her insurance card. So, I mean, there's different levels of people that we're interacting with every day, either based on age or experience, literacy. So many factors go into understanding how the system works. Prevention also is another area we spend a lot of time on, and we keep it as basic as possible. You know, there's so much information about prevention, it can get overwhelming. So we really try to direct adult learners to very few high quality resources for prevention advice, as well as a curriculum that I'll tell you about a little bit in a moment. And then navigating the healthcare system. We have curriculums and activities designed for students to learn how would they actually choose a policy. We definitely push healthcare navigators, and in Florida, we are lucky that we have continued to have a good number of navigators that can assist students. But you know, when you're trying to compare 2 or 3 policies, even with a college education, I think it can be difficult. And so we really work with improving skills on understanding an insurance policy. So first getting it and then understanding how do you use it. So the approach that we take is called contextualized instruction. And so I hear a lot about health literacy in terms of how do we design educational materials at a 5th grade or 6th grade level or lower. And I really think this is an important part of health literacy, right? We have to have resources and information to provide to people who have lower literacy skills that they can understand. But really, when we're talking about health literacy, it's a much bigger picture than just, do you have information that's written at the appropriate level? We have to have comprehension. We have to have numeracy skills. As Greg mentioned, digital literacy skills have been huge this past year. And we've really seen that digital divide and that digital disconnect for many of our adult education students. They are not accessing information online. They may not even have internet access at home. So literacy skills, conversation skills, critical thinking skills. So really, when we're talking about how we can incorporate health literacy into adult education, we're looking at a more kind of holistic, comprehensive approach to doing that. And so there's different topics that you can use, but basically you're teaching those skills that we just talked about, but you're doing it through the lens of health literacy. So as they're learning about reading graphs and charts, as they're building their numeracy skills, they're doing it while acquiring health information. So it's kind of a great partnership. So I love this picture in the top of 2 students at Miami-Dade College. They partnered with the laboratory on their campus, a science lab, and they learn about nutrition and calories and all kinds of things by going into a lab and actually figuring out and seeing how things actually work. What a great partnership that they have developed within their own institution. Do you have a lab in your institution? Could you be working with an adult education program, for instance, on doing a science-based activity like this? In the bottom right, and I'll show you throughout this, we have lots of pictures of the different activities. Cooking classes are a big thing among adult literacy professionals and students. They love cooking classes. What a great opportunity, again, to teach about math. So you're talking about measuring, you're talking about what's a cup versus a 1/4 of a cup, what's a teaspoon, what's a tablespoon, how do we add those together? There's just so much math that can go into cooking, while at the same time, they're learning those skills of how to prepare a healthy meal. A lot of programs kind of look at, especially for ESOL, whatever recipes are kind of, home or family recipes, looking at those and making those over into a healthier form is also really popular among students. So we do have some outcomes. These are from our 2019-20 year, but really these remain pretty consistent year to year in terms of how our health literacy program affects students. So most of our programs are 6 weeks, 8 weeks to 12 weeks, typically. So this is a wonderful opportunity to engage. So when I used to organize public health programs in kind of other aspects of my career, getting people to attend was always difficult. So partnering with adult education is fantastic because we have students there who are motivated to learn. They are trying to improve their lives. They're trying to improve their career potential. And they are doing this on their own time. Many students, it just amazes me. Many of these students have full-time jobs, 2 jobs, and they're also in school at the same time. So they are eager to learn. And we've really seen great results through our health literacy program. Another piece that I think is really important, as you can see from these stats, 88% recommended the program, but also the number of students who shared health information with others in their community or their family, 89%. So we really see by doing health literacy programming with adult education students, it spreads out within the community. So we can really have a higher bang for our buck in terms of getting this information out and affecting communities who are at risk for low health status. We also have a big focus on knowing where students can go in the community to get low cost medical care. So that is definitely a big impetus and a big push for us. But you can see we've used pre and post tests and 77% in 2019 to 2020 improved their score from the pre to the post. And again, that's pretty consistent from year to year. So partnerships are key to the success of our program. There are so many great partners out there that have been willing to work with our adult education providers, but I will tell you there's room for growth. When talking with our health literacy grantees, that's something that they consistently say to us, is that sometimes they feel like they're calling around just begging for help. But this is such a great opportunity to reach students and reach students repeatedly. That's the other really beneficial thing I think about health literacy programming within adult education is it's not just a one-shot deal. As I said, these students are in class for 8 weeks, 12 weeks, 16 weeks with the same instructors. And so it's a great opportunity to really work on not just, kind of soundbite information, but really deep, digging deep and getting those skills so where they're confident. Health insurance providers, obviously, we work with Florida Blue as a great partner for us, but also libraries, pharmacies, IFAS, which is our agricultural organization within the state of Florida. They do a lot of programming with us on nutrition, especially fire departments, poison control, so many different partnerships. So this kind of shows you some specific types of things. And really these partnerships tend to come out of whatever is going on in the community. For instance, you see Highlands County Soil and Water on here. There were some issues in Highlands County in terms of well water and its safety. So they incorporated that into the curriculum, and this district office helped to test well water of the students. So, I mean, it really was meeting the needs of both organizations, right? We were improving the health literacy knowledge and safety of students, while at the same time, the district office was able to do more outreach and really kind of, achieve their goals in terms of making sure that people had safe water to drink. Fire department is another really valuable resource that a lot of our organizations use. And I'm going to show a video in a few minutes, and you'll see CPR is another really popular class. And they often partner with Red Cross or other organizations in the community. But for students that kind of do CPR training, it might be the first certification they've ever gotten. We're able to do it in a more slow manner of teaching than perhaps if you took a regular class. So there's just so many really cool partnerships that they have developed. So in terms of health literacy within adult education, what we have learned in terms of effective program development is just very similar to, program development in other areas. We take a theory-based approach to lesson development. We look at kind of, theories of behavior change and knowledge acquisition. We always administer pre and post behavior and knowledge assessments that help us to really understand if what we're doing is useful and continue to grow and change from there. Hands-on activities and field trips are huge. We find most adult education students, they don't want to sit and listen to a 2-hour lecture. So we are really very hands-on, getting people experience in the community, experience, like I said, with different organizations. Project-based learning is another important skill, and then digital literacy skills. So at FLC, we do have what is called the Staying Healthy resource curriculum, and these are some of our titles. These are freely available and kind of can give you an idea of what I'm talking about in terms of theory-based instruction, and then also what 5th grade level actually looks like in terms of providing health literacy information. So we have a student resource book as well as a teacher's guide. This has been downloaded more than 1 million times, and it has been tested and is really a fantastic resource. And we have people from all over the country as well as all over the world using the Staying Healthy book. Our newest item is our Health Careers Guide. And I point this out because I think in many states, as well as the state of Florida, we don't have enough healthcare professionals in Florida. And we're really projecting that it's going to be the largest growth area in terms of occupations in the next 5 to 10 years. And so the Florida Department of Education, partnering with us, came up with this Health Careers Guide. How can we start working with adult education students now to help them start to think about the health careers that they might be able to move into once they get their GED? So we focused on 25 high demand jobs in our state that require 2 years of training or less. And it's been really popular. So in terms of thinking about partnerships, especially if you work for a hospital or clinic and are looking for employees, this is another great partnership, helping to mentor people along and helping them to see a vision that they could have a high-paying job, a living wage with benefits in turn, after they receive their GED. Because for some students that we work with, they don't see the vision of where they can go, what their next steps could be. And so in this guide, we really try to break it down, especially looking at ladders for nursing, for example. What's the ladder? What can you start with? And then what certifications can you gain as you go along? We also incorporate a lot of field trips and classroom visitors. So again, this is another great area for partnerships. A lot of hands-on types of things. Health fairs are definitely popular. Sometimes the students even organize these health fairs on their own. So they're gaining education as they are putting on these events. Also, I love this picture at the bottom of them doing Zumba, yoga. A lot of physical activities are really popular with our students as well. Another piece that we do is project-based learning. And for those of you who have kids, you probably in the K-12, they're doing more and more project-based learning because research is showing us that it's more effective, right, than a lecture format. So we really try to challenge our instructors to come up with project-based learning opportunities where the students are gathering the information, they are developing or answering a question or developing a material, and then they are in turn educating others. I think that this is another great partnership opportunity for public health organizations, clinical, other organizations to work with adult ed in terms of producing products, producing educational materials that are relevant to different communities. So really it's kind of a win-win in that situation. When students use project-based learning, it really helps them to acquire, an understanding of the information on a deeper level. And then they are able to kind of turn that into being more real to how they talk, to the concerns in their community or their families. And we increase their confidence by, giving them an opportunity to have an impact on the community. So there's little projects, there's big projects. And if you check out our website, which is floridaliteracy.org, we have a lot of those different projects that are listed that our students have done. Maybe they make a resource guide, as I mentioned earlier, of the health resources in the community and distribute that. I know that's been done in several different places where then city government is distributing these resources, on a larger scale to community members. I love this picture in the bottom. This is a community garden in Flagler County. And you'll see this in our video too, but they have the returning students in the adult education program teaching new students about gardening and healthy eating. And then they make recipes with all of the vegetables that they grow. So another great, form of learning. So, thinking about how can you be involved in these types of activities, because in Florida, again, we're really lucky to have the support of Florida Blue, but for many states, they may not have a health literacy coordinator like myself who's providing materials. They may not have additional funding. So really it's hard for these cash-strapped organizations to be able to do health literacy. I'm so impressed with how most literacy organizations operate in terms of the amazing things they're able to do on a shoestring budget. And so health literacy for some is not as accessible. So that's one of our goals, is to try to make health literacy programming accessible to all adult education programs. So here's a few more examples of other types of activities that people have done in their different programs. Another one that I really like, there is one school in DeSoto County, and every day at 12 o'clock, everybody in the building gets up and goes for a walk, and they have like a health lesson that they discuss while they're walking around the building for 15 minutes. I mean, there's just so many like cool ways, cool activities to incorporate health literacy into everything that people do. And that, for example, isn't just for students in the health literacy program, that's for all students that are in their building. Another piece of health literacy that I think all strive to do is, to kind of incorporate, explore cultural differences, and really adult education programs do a great job of this, of recognizing differences, learning about each other, and celebrating those diverse populations that are in their community. And really that does produce positive health outcomes. So whether it's cooking, as I mentioned, shared experiences about healthcare, there's just so many different ways that people can talk about medication, common types of treatments in their communities, and it really goes a long way, I think, in making people feel comfortable and feeling open to learning about other people's ideas. I really think the students end up educating each other. So now we're going to watch a video. We have lots of different videos on our website that kind of talk about the programs that we've done. I just chose one particular year, but if you're interested, we have an overview video that shows kind of all about our program, and it interviews different students as well as instructors. This is one that we put together for Florida Blue, just kind of showing them all the activities that we did in a particular year.
Good morning. Welcome to South Trail Library's ESOL class. We've been studying healthy living. With our Staying Healthy for Beginners textbook.
My class, I learned how to shop healthy, how to eat better, the question to ask my doctor: what will this medicine do? How to read a prescription, the difference between the ER and urgent care, how to deal with stress.
This was a successful project. I think the institution should be proud of having these students not only learning about English skills, but also learning about health. The students were really scared at the beginning because they thought they could not do it, they could not really speak in front of the public. But at the end, it was all great, and they all had an amazing experience.
So I hope you can see from that video, I mean, it's pretty amazing what non-health professionals are doing in terms of health literacy. You know, they really are kind of public health educators, even though that might not be their, their training from college. So when we're talking again about partnerships, I think that there's a lot for community partners to do in terms of understanding adult education students and organizations. When I talked to our health literacy grantees, they really felt like that was an issue, that when they do reach out to health departments or when they do reach out to hospitals for help, there's really a disconnect in terms of understanding what an adult literacy or adult education student looks like, what their needs are, what their concerns are. So I think for this partnership, it's really two ways. And I'll continue to talk about, there's a lot of benefits to us as health literacy practitioners in terms of having these relationships with adult education students. It's not just us coming in, but there's so much for us to learn about our communities through their eyes. So conducting student focus groups and assessments, I think, is definitely a great way to understand your population more. And talking with instructors. I have learned so much by talking to adult education instructors about what's it like to teach. What are the stories that you're hearing from your students? What are the challenges that they experience in their everyday life? What are some of their stories? Because that really does bring it, alive to us in terms of what the need is. And then, I go back to my days in getting my MPH, doing a community needs assessment. And I tell my health literacy instructors the same thing, drive around the neighborhoods of where your students live. What do you see? For us, a lot of our students are in places where there is no healthcare accessible. There may not be close grocery stores. So, we really have to consider that in terms of looking at what they need. When I, again, ask those kinds of questions about what do you wish you had, mobile healthcare was a huge one, because for some places, especially one person I was talking with in Fort Lauderdale in Broward County, it's a huge issue for them. And when mobile healthcare does show up, she said it's, everybody, it's the adult learners and their families and other community members as well. So there's such a need out there, and that I think it's such an important population to learn from and learn from their stories. So how can we develop effective partnerships? So, definitely providing plain language healthcare and educational services, but thinking about how can those match up with the mission of your organization and your goals. If you are trying to do more screenings, for instance, well, that's a great opportunity to reach out and get the word out about the program that you're trying to launch. Because again, we find that students, communicate with their family members, they communicate with their friends and people that they know from different social organizations. And it's, a very effective word of mouth way to get information out. Are you trying to teach about navigating the healthcare system or insurance? Are you seeing that you have patients coming in who are not, really understanding the system? Well, what can you do? What partnership can you develop in order to achieve that goal? Facility tours are another big one. So if you look at our Staying Healthy curriculum, one of the first things that we have in there is a map. Just trying to teach people how to read a map in order to be able to find what they need within a large, clinical setting. So maybe you can have those tours. Maybe you can teach about maps within your organization in that partnership. We do find that lunch and learns can be useful, but again, for most of adult learners, they don't want to listen to an hour lecture. They're looking for a different type of experience. So really being creative in terms of how we develop our activities. And make sure that we incorporate everybody, no matter their literacy level, no matter their learning style. Partnering with adult education providers on community events as well is really important. And then offering referrals for each other's services. This is another one that I've kind of heard about. If you have a patient or a client that you're working with that has low literacy skills, do you know the resources in your community that you can then refer them to so that they can work on improving basic literacy as well as their health literacy skills? Do you have a local health literacy committee? Would be another question. I know many cities and states do. And who is on that committee? Do we see adult education organizational members on those committees? Because I really think that's key. If they're missing off those communities or off those committees, you're really missing some key people to provide high quality feedback and information on, on needs. Testing materials, classes, and programs with adult education students is another one. So we have seen several examples of that. We really encourage you to pay if possible, but what a great place to test those materials. So when I go in and test my materials, I then, after I'm finished, then we tend to go ahead and go through those materials. So I kind of have a double goal of increasing education and knowledge at the same time that I'm testing my materials. And that is so important. Even within, I think I'm pretty good at making materials. I have a journalism degree. I've worked in adult education, and every time I test my materials, there's definitely great feedback that I get, and perspectives that I hadn't considered when I was developing those materials. You could invite adult learners to be health ambassadors for your organization. Again, great relationship that could be developed. That could really help adult learners in terms of helping them with their confidence, their skills, and just understanding of community resources. It could also help your organization in terms of helping get people out to events, helping people access services and things like that. Job shadowing opportunities for adult learners. I've heard from our grantees that this is another area that is very difficult for them. So perhaps they have worked with an adult learner who's interested in a particular career, but it's very hard for them to find out more. We obviously have online resources, but what another great opportunity to develop relationships and then perhaps increase the labor pool in terms of having more people interested in getting some of these certifications. In Orlando, where I am, one of the organizations that we work with paired up with UCF's medical school. And so a lot of their health literacy information was being taught by medical students. So again, what a great opportunity to partner. Those students were learning a lot, I imagine, in this experience by teaching and meeting adult education students. And then the students benefited as well. And then also having joint trainings or discussions between healthcare staff and adult education students. What kind of planning can you do together? What kind of lessons can you learn from each other? I think that's really valuable as well. So I kind of mentioned a few things as we've gone along in terms of when I asked our partners, what do you wish you had help with? The one that mentioned to me about the mobile healthcare service, she said, I wish just one day that somebody would call me and ask me to partner with them. And I really thought that that was telling, is that really kind of, it's been a one-way type of relationship. But I hope you see from our discussion today how wonderful these partnerships can be and how beneficial they are to both parties. Expert speakers who understand the needs of the adult ed population is another big one. People are trying to explain things in plain language, but we all know it's really challenging. And so it's really important for us to have experts in their field who can talk to people at different literacy levels. And they also pointed out that sometimes they might get somebody who's just a general practitioner, but very rarely do they ever get any specialists, physical therapists, nutritionists that come out and partner with them. Also, another big area that they would like to see growth in is how to use the clinic. According to our partners, that is really a big issue for adult learners. So one of the activities that they commonly do is called a mock clinic, where they will pretend, one person is the front desk person, somebody's the doctor, somebody's the patient, and they kind of, do these different dialogues and they switch positions. But how wonderful would it be to be able to partner with a healthcare organization or a public health department in order to have kind of those even more real interactions. So those are a few areas that they let us know. So I'm going to take a look real quick, and I'm not sure if we have some questions, but I'll take a look at our Jamboard. Greg, were there some questions?
Yeah, we do have some questions. One is, I'm interested in updating stats we have about health literacy, which are now almost 20 years old. Do you know of a project for this? Would you be interested in talking about such a project? Well, absolutely interested in talking about a project, because this is a problem. It really is a significant problem. Back in 2003 was really the last national data that we shared with you that we're aware of that really looked at health literacy from sort of a broader adult population perspective. So when that study was redone, and it was the National Assessment of Adult Literacy, and then it became sort of morphed into what was called a PIAC study, they dropped the health literacy component. So whether it be something on that level, that's a national level, and we're trying to promote the alignment of health literacy with the next round of PAC data. I'm not sure if that's going to work or not, but we're trying to advocate for that. And also there's need for research in this field. And so, and I know a couple of people look like they've commented on the data being so old. Heather, do you have any resources? One person asked about whether there are good resources for more current statistics or statistics in general.
So there has been some research within pockets, but in terms of overarching research, like we were just talking about, I am not aware of any, unfortunately. I do think that a lot has probably changed, and we need a large scale research project looking at how health literacy has moved, hopefully positive direction. But definitely if you do a lit review, there's a lot kind of in different pockets.
Yeah, smaller projects that taken collectively, really do point in a certain direction around the importance and impact of health literacy interventions. There is this is not health literacy per se, but the county health rankings that the University of Wisconsin does with Robert Woods Johnson Foundation around the sort of social determinants of health. And we do draw on that data a lot to really show the wide range of statistics that are related to health and healthy communities and health outcomes. So if there are other statistics or other resources, I know IHA has some as well, please add it to the chat because we'd love to hear what you know. The next question is, can you speak about social context of health literacy and how getting things done in health settings is a team effort, particularly for adult language and literacy learners and their network of support, such as family and community members who assist them. This really affects how we view health literacy and how we support people to meet their health goals. You want to take that one, Heather?
Sure. So we hear that from students. So when they try to make changes in their life, for example, they need the support of their families. If they're changing, for instance, their family recipes to be healthier, they might get some pushback. If they're trying to exercise more, they might get some pushback. So, our instructors really try to look at that in terms of the social construct of communities and part of their needs assessment to figure out what those challenges might be and how to overcome them. Especially in terms of access to care, utilization of care. That's also, a big issue. With COVID vaccines, for instance, I know several of our grantees have been trying to do a lot of work in terms of educating not only the student, but their families. Another piece we talked about a little bit was family literacy, which is kind of growing, I think, in interest. Everything is kind of cyclical. We've been focusing more in terms of just adult literacy, but now, at least in Florida, we're starting to really kind of go back to looking at family literacy as a model as well. And that could really play a role too in terms of focusing things in terms of kids and educating kids can sometimes help with social support.
One thing I might add is, there are challenges. I'm not a clinician, but we certainly have heard and read about problems sometimes when family members with all good intent, aren't always the best equipped, in terms of making sure that treatment plans are followed and medication regimes are followed and so forth. So for those of you who are doing teach back, I think there's certainly a lot to be said for making sure that the family members who are assisting those patients are included in that teach back process, just to make sure that everybody's on the same page with regard to what needs to be done. The next question is, can you elaborate on the did not receive the information from the internet category? That must have been on one of your slides, Heather. Does that sound familiar?
Or perhaps that was maybe it was. So I'll try to interpret this the best that I can. We definitely see adult education students accessing health information, at least prior to COVID, at a lower rate than people of higher literacy levels. So that is something that we try to measure when we are teaching about digital health literacy. Again, we try to pick several high quality resources that we teach our students about. And then we kind of on the follow-up want to ask them, so as a result of taking your health literacy class, have you accessed, health information online or new health information online? So that's kind of what we're trying to look at. It tends to not be very high. So I think maybe because of the needs that were illustrated to us through COVID, I'm thinking that instructors are probably spending more and more time looking at digital health literacy and trying to improve student skills. I know at FLC, we are developing a new curriculum and really trying to have more resources available for digital health literacy skill building.
And one of the things with adult education is they really have a lot more time with students than you typically find in a lot of sort of community health projects. So there is an opportunity to dig in a little bit and really help, look at websites and help people distinguish between reputable sites and not so reputable sites. And really find good, solid information that in sources that people can rely on. So, that's sort of speaking to the broader health spectrum, but sort of the intensity and duration there. There's a lot of repetition, a lot of revisiting to make sure that these concepts are internalized with the students. The next question, how can we get a copy of the Staying Healthy in Careers Guide? We put a link in there, I believe, to both those publications on our website. So that should be on the resource side, I guess. And I put it in the question side too. So we're kind of working
also, if you look at our slides right now, if you go to floridaliteracy.org, on our left toolbar, we have a health literacy tab that will take you kind of to a lot of the different resources that we have, our curriculum, as well as recommendations for other curriculums, activities and lessons. So there's really a lot of information. And then also a little bit more kind of about our initiative and how it works and our results.
Yeah, the curriculum is available. They're all it's all freely available on the websites. We do have hard copies if folks are interested. They're fairly, we don't make much money on those. They're like $5 each if you're interested in having a hard copy. But everything that we have is up there and is freely available and used by quite a few. We've gotten feedback, anecdotal feedback that they're used by non-adult ed specific programs, doing a lot of community ed type work too. And if you do use it, we'd love to hear how it goes. Let's see here. I know we only got a few more minutes, but have you worked with government, law offices, hospitals, and others to change the original materials to treat the problem at the source? Now, we've done a little bit of that, but not as much as some organizations have. I know there's Wisconsin Literacy has sort of a specialization on that, and I know there's a number of others. We've done a lot of plain language development, but what you're talking about is really a fundamental issue that that health providers definitely need to make sure their materials are accessible and understandable to all of their patients. And I think if you partner with an adult ed provider, it could provide a great opportunity to really test out some of those materials with a population that isn't sort of dealing with an immediate health crisis, but have skills challenges, so that you can really make sure that if you take sort of a universal design approach where you're really trying to develop materials that are accessible to folks who have minimal English language and literacy skills. I know some programs or some hospitals and healthcare providers have even done sort of walking focus groups where they have people walk through their facilities and kind of try to, look at their internal navigation and things of that nature. Anything you want to add to that, Heather?
I would agree. And I think if you develop a good partnership with an adult ed organization, that'll be a natural piece. We definitely have had organizations reach out to us and ask, to work with our organizations, which I think sometimes they're able to accommodate it. But I think it works much better within a partnership. But when I've tested, as I said, my materials, I have gotten a ton of feedback. Like usually they're very enthusiastic about kind of helping me to understand their viewpoints. So it is definitely needed, and it's, you know, a great population that is there
Right.
within your community. So if you can reach them, I think that's really good. And I think offering incentives is good. For some people, it's really difficult for them to get to class. It's very difficult for them to manage things. So that definitely
Okay.
can help with participation.
Well, we're at the end of our hour here. So if there's anybody else that has questions, feel free to email us or contact us. We'd love to have a conversation with you or respond to that. And thank you to IHA for making this opportunity available for us. And we wish you all well. Yeah,
Thank
have
you
a good
very much.
afternoon. Thanks.